Hi, this is my first attempt in making quick review for boards. This is anti-cancer drugs, and I have tried to make the understanding of this pretty complicated subject a bit easier through a simplified categorization and couple points here and there. I hope it works. One more time, I want to mention that this is output-based learning. The purpose of this video is to provide an example of how to explain subjects with the purpose of teaching or discussion with colleagues or maybe patients or their relatives can help understanding and learning the subject for the healthcare provider. So anti-neoplastic drugs in the most basic way can be categorized into three categories. They include cell cycle specific anti-neoplastic drugs, cell cycle non-specific anti-cancer drugs, and I categorize the rest as miscellaneous drugs. The cell cycle specific drugs can be divided into three major categories. They include mitotic inhibitors, synthesis phase inhibitors, and G1 and G2 inhibitors. The mitosis inhibitors include microtubule inhibitors, either zinc alkaloids or taxane type drugs. The synthesis inhibitors include anti-metabolites, topoisomerase inhibitors, and based on some references, hydroxyurea is also S-phase specific synthesis inhibitor. And finally, G1 and G2 inhibitors include the steroids, and then the only antibiotic that's not cell cycle non-specific and is G1 and G2 inhibitor is bleomycin. Let's talk a little bit about cell cycle non-specifics and miscellaneous drugs, and then we will go ahead with more detailed review of the points related to these drugs. Cell cycle non-specific drugs include the broad category of alkylators and then antibiotics other than bleomycin. However, an important point about cell cycle non-specific drugs is all cell cycle non-specific drugs, either alkylators or antibiotics, to be more precise, anthracycline type antibiotics, all of them produce free radicals as their mechanism of action. However, alkylators use that free radical to cause different type of damage than that of antibiotics. And then we have finally miscellaneous category of anti-cancer drugs. They include tyrosine kinase inhibitors, growth factor receptor inhibitors, and the other miscellaneous drugs such as asparaginase, rituximab, and interferons. Okay, maybe now I should talk a little bit about the points related to these drugs. First question, and now I try to use the question format or flashcard format. I call it audiovisual flashcards. What is the oncovin? Well, the answer is oncovin is the other name for vincristine, and you know the other zinc alkaloid is vinblastin. Important question regarding M-phase or microtubule inhibitors, M-phase specific or microtubule inhibitor anti-cancer drugs is what's the exact difference in their mechanism of action. Yes, both of them are microtubule inhibitors or mitotic inhibitors. The answer is zinc alkaloids. Zinc alkaloids block polymerization of tubulin. Taxanes such as paclitaxel or other Taxol's drugs, they hyperstabilize the polymerized microtubules. If you're asked in terms of mitotic spindle, what's the effect of zinc alkaloids as opposed to that of Taxols? Zinc alkaloids prevent formation of the mitotic spindles, while Taxols prevent the breakdown of mitotic spindle. And a very important question that you might be asked is regarding the side effects of zinc alkaloids. We always remember that peripheral neuropathy is an important side effect of zinc alkaloids. This could open the gate to you to also think about possibilities of areflexia and paralytic ileus. So these are all neurologic related side effects, and these are those of zinc alkaloids. And other than this neurotoxicity is an important point to remember that not vincristine but vinblastin causes bone marrow suppression. The mnemonic says it blasts your marrow. True or false, zinc alkaloids are only useful against solid tumors. That's not necessarily so. Zinc alkaloids can be used also for lymphomas or leukemias. Well, that said about the mitotic inhibitors, it's the time for this exciting group of drugs, S phase specific anti cancer drugs. Um, I categorize them into anti-metabolites, topoisomerase inhibitors, and hydroxyurea. Anti-metabolites, you will remember them forever if you think about the anti-metabolites as analogs, either nucleotide analogs or folate analog. First of all, let's take care of the folate analog, which is the easier one. That's the famous drug methotrexate. Of course, all of you know that the mechanism of action is inhibition of the enzyme dehydrofolate reductase. However, the kick is you might be asked what's the final effect of this drug, and you don't see anything about the hydrofolate reductase inhibition. Instead, you see something that you expect to find about pyrimidine analogs such as 5-FU. In other words, you may be provided a choice that says it reduces the oxythymidine monophosphate synthesis. You should remember that the final product of the circle of the chemical reactions that the hydrofolate is involved in will result in formation of DTMP for the synthesis of DNA and protein, and this is where the pyrimidine analog anti-cancer drugs and folate analog anti-cancer drug methotrexate have a final result in terms of inhibition of cell cycle, and that's inhibition of synthesis of DTMP. That's another way to mention the mechanism of action of this drug bypassing the intermediary pathway. Okay. So that said about methotrexate, you of course remember what's the other name of leucovorin. Leucovorin is the drug that's used to reverse the toxicity of methotrexate, and that's actually folinic acid. Which one of the side effects or toxicities of methotrexate will be taken care of or can be taken care of by leucovorin rescue method? Both myelosuppression and GI epithelial disturbance or destruction can be prevented by leucovorin rescue or can be reversed by folinic acid. Okay, pyrimidine analogs. Now we are talking about nucleotide analogs that are subdivided into two groups of pyrimidine and purine analogs. Pyrimidine analogs, we have talked about one of them, which is 5-FU that inhibits DTMP. The other ones are the ones that have CYT in their names for cytidine or cytosine. It includes cytarabine and gemcitabine. Okay, this way you remember they are pyrimidine. And purine analogs include azathioprine, which is a thiol drug, as the name indicates, and also 6-mercaptopurine and 6-thioguanine. You are provided a list of the anti-cancer drugs or anti-metabolites, especially anti-cancer drugs which are anti-metabolites, and you are asked allopurinol will increase the toxicity of which one of them. You remember that the purines require xanthine oxidase for their metabolism, and allopurinol inhibits xanthine oxidase, and therefore 6-MP6-DG or azathioprine could be the good candidate for the choices you are provided. In another way, you can be asked which one of the anti-neoplastic drugs require activation by the enzyme HGPRT, hypoxanthine guanine phosphorybazole transferase, and they are again purine analogs, 6-MP, 6-TG, and azathioprine. Which one of these drugs you will choose if you are asked which one of the cell cycle S phase specific drugs is capable of inhibiting DNA polymerase? Despite the fact that either one of them can do that, you preferably choose the pyrimidine analogs, especially and if you're asked which one can cause megaloblastic anemia, again you can choose pyrimidine analogs. However, any one of the anti-metabolites can cause megaloblastic anemia in theory. Okay, in addition to these analogs or anti-metabolites, what are the other S-phase-specific anti-cancer drugs? They include topoisomerase inhibitors and hydroxyurea. Topoisomerase inhibitors themselves are divided into topoisomerase 1 inhibitor, which is S-phase specific, and the topoisomerase 2 inhibitors, which are SG phase specific. Can you mention some of the topoisomerase 1 inhibitors? They include drugs that end in tecan, such as topotecan and irinotecan, and topoisomerase 2 inhibitors are drugs that are end at poside, such as etoposide, or let me see here, teniposide. Okay, so if you're asked teniposide, Uh, you can think of first comes a tecan and then comes a pose. So topoisomerase 2 inhibitors are later and they are specific to S to G phase, while topoisomerase 1 inhibitors such as tecan type drugs, irinotecan, topotecan are S phase specific. Okay, we mentioned hydroxyurea is another S-phase specific anti-cancer drug. What is its exact mechanism of action? Remember, it inhibits ribonucleotide reductase. Do you remember its mechanism of action that causes it be a valuable drug in treatment of sickle cell anemia? Yes, it increases with an unknown mechanism. It increases the percentage or level of hemoglobin F. What are the G1 and G2 specific cell cycle specific anti-cancer drugs? They include the steroids and all the families related to steroids, plus the antibiotic bleomycin. Can you mention what steroids are used as anti-cancer? The most commonly used is prednisone. We also have oxyfen type drugs such as tamoxifen, raloxifene as selective estrogen receptor modifiers or SERMs. Then we have GnRH analogs such as leuprolide and relin drugs such as goserelin, gonodarolin. And we have anti-androgen, the lutamide drugs such as flutamide. And we have aromatase inhibitors such as exemestane and anastrozole. These are aromatase inhibitors that I've mentioned here. Two specific points regarding bleomycin is, well, maybe three. One is it's the only anti-neoplastic antibiotic that is cell cycle specific. The other is it doesn't cause much myelosuppression in its side effect profile, but instead it causes pulmonary fibrosis. And the other point is its relative or family member, neomycin, is cell cycle non-specific. One little question before we proceed with cell cycle non-specific drugs is what type of cancers are usually treated with steroids and what are the most common steroids used as anti-neoplastic? The most common ones are prednisone and prednisolone, and the cancers are usually lymphomas and leukemias. Two important questions regarding alkylators and antibiotics of cell cycle non-specific anti-cancer drugs. What's the common mechanism of action? All of them, including even cell cycle specific antibiotic anti-cancer bleomycin, produce free radicals. What is the major mechanism by which the free radical production functions as anti-cancer drug in the case of alkylators versus anthracycline antibiotics? The mechanism of anti-cancer free radical production by alkylators include cross-linking of DNA, abnormal base pairing, and strand breakage, while in the case of anti-cancer antibiotics, such as especially anthracyclines, the mechanism is intercalating. So it's the intercalating between DNA strands. What are the groups of alkylators? They include nitrogen mustards, nitrosureas, alkyl sulfonates, and other drugs. Especially we begin with other drugs. They include platin drugs such as cisplatin, carboplatin, oxaliplatin, and azines drugs such as procarbazine, dacarbazine. Alkyl sulfonate is the busulfan among the alkylators, and then other groups of alkylators include nitrosureas such as drugs that end at mustin, such as carmustin, lamustin, and then the nitrogen mustards are the drugs that you can find clo in their names. The most important is cyclophosphamide, but also mechloretamine and chlorambucil. These are nitrogen mustard alkylators. Which one of these drugs can cause SIADH among alkylators, and what is the famous other side effect of this drug? Or a patient who has SIADH under cancer chemotherapy for, say, a lymphoma or breast cancer has SIADH, what other possible side effect can be seen? Well, we should remember that cyclophosphamide is an alkylator that is notorious, that can cause notoriously causing SIADH. However, the more famous side effect of cyclophosphamide is hemorrhagic cystitis secondary to its cytochrome P450 metabolism to a metabolite called acrolein, and the treatment for acrolein is mesna mercaptoethane sulfonate. True or false, meclorethamin converts in the body to a reactive cytotoxic product? Well, you just need to remember that meclorethamin is one of the alkylators, and therefore it is going to be metabolized or produce a free radical that's cytotoxic, as all the alkylators cause that. Okay, let's begin the side effect profiles of alkylators with platins. What are the important side effects or toxicities? With platins, we could remember that cisplatin causes more nephrotoxicity than carboxyplatin. Carboplatin is more myelosuppressive than cisplatin, and all of them, including especially oxaliplatin, cause neuritis. This neuritis is especially acoustic neuritis and peripheral neuritis. How to prevent the nephrotoxicity with cisplatin? Um, Amifostin is a free radical scavenger. Mannitol diuresis or chloride diuresis and excessive hydration are other modes of preventing nephrotoxicity with cisplatin. Which one of alkylators produce hydrogen peroxide? They are azine type drugs. Procarbazine. Mention specific side effects of procarbazine. It can cause disulfiram-like reaction in addition to the general side effects of alopecia, GI distress, and myelosuppression. It can cause disulfiram-like reaction, and it can also cause inhibition of monoamine oxidase and also is leukemogenic. Which one of anti-cancer drugs are having vesicant effect? They include nitrogen mustards, like especially meclorethamin, and anthracycline antibiotics. Which one of the alkylators are a good choice for treatment of brain tumors? They include nitrosureas such as carmustine and lomustine because of their high lipid solubility. Which one of the alkylators is notorious in causing emesis, vomiting, and requires ondansetron? That is cisplatin, and that's because it possibly directly stimulates the chemoreceptor trigger zone. You might therefore be asked which one of them has direct stimulating effect on 5-HT3 receptor, and again that's cisplatin. Which one of the alkylators are specifically used to suppress a patient's bone marrow prior to bone marrow transplantation? That is alkylator busulfan, the alkyl sulfonate. What's the other use of this drug? That's used in CML regimens. What is drug streptozocin? Streptozocin belongs to the same category of mustins, nitrosureas of the alkylators. What do you expect to see in side effect profile of streptozocin? Well, because it belongs to the group of nitrosureas, and we mentioned that they are highly lipid soluble, therefore they can be used for brain tumors, including glioblastoma multiformis. They will have CNS side effects, including seizure. What's the exact location of action of cyclophosphamide? It causes cross-linking of intrastrand cross-linking of double-stranded DNA at guanine N7 position. A patient received an anti-cancer therapy prior to bone marrow transplantation for CML, and now he has got skin rash. What other tests should be monitored? That's respiratory function test, because that drug that's used is busulfan, that specifically causes skin rash, and also that's the most notorious drug among anti-cancers to cause pulmonary fibrosis. We can see restrictive pattern in pulmonary function test, for example. What is adriamycin? Adriamycin is another name of doxorubicin or hydroxydonorubicin. They belong to the category of anthracycline anti-cancer antibiotics, therefore they are cell cycle non-specific. Do you remember their mechanism of action? They produce free radicals and cause intercalation of the DNA. We mentioned intercalation of DNA secondary to free radical production is possible with alkylators or anthracycline antibiotics. What's the difference? The difference is alkylators produce covalent cross-linking, while the anthracycline antibiotics cause non-covalent intercalation. In other words, they intercalate non-covalently. What is notorious side effect of doxorubicin, and what is the way to prevent it? Doxorubicin, daunorubicin, anthracycline antibiotics are notorious to cause cardiac cytotoxicity, especially in the form of dilated cardiomyopathy and an iron chelator, which is dexaroxane, is the way to prevent this cardiotoxicity with anthracyclines. True or false, actinomycin D is an intercalator antibiotic anti-neoplastic drug. That's correct. We mentioned all anti-tumor antibiotic, including actinomycin, mitomycin, bleomycin, are all intercalators. What are the uses of actinomycin D? Remember, dactinomycin or actinomycin D is used for childhood tumors, especially Ewing sarcoma, rhabdomyosarcoma, and Wilms tumor. By the way, do you remember we talked about skin rash with busulfan? What type of skin rash? That's hyperpigmentation rash. Mechanism of action of what anti-cancer drugs mimic adenosine deaminase deficiency? Well, first of all, you should remember that adenosine deaminase deficiency causes accumulation deoxy ADP and ATP, and they suppress the key enzyme called ribonucleotide reductase. The enzyme that produces deoxyribonucleotide diphosphate, such as DUDP or DADP, whatever. There are two anti-cancer drugs that also prevent the action of ribonucleotide reductase other than adenosine deaminase deficiency through accumulation of ADP, ATP, and those anti-neoplastic drugs, as we mentioned, are hydroxyurea, but also gemcitabine. True or false, hydroxyurea is used for treatment of polycythemia vera by increasing hemoglobin F? No, increasing hemoglobin F is the mechanism of hydroxyurea for the treatment of sickle cell disease. For any one of the chronic myeloproliferative disorders, including essential thrombocytosis, polycythemia vera, and chronic myelogenous leukemia, the mechanism of the drug that we rely on is the hydroxyurea's prevention of ribonucleotide reductase. Okay, finally, this little group of miscellaneous anti-cancer drugs. What cancers is treated with imatinib? Well, remember, in addition to famous CML with that Philadelphia ABL-BCR, Philadelphia chromosome, and the fusion tyrosine kinase that's produced, GI stromal tumors are also treated with this drug, imatinib. What's the other name of imatinib? It's Glivec. In what type of cancers we can use the rituximab? Well, rituximab, because it is the inhibitor of CD20, and CD20 is a B-cell marker, can only be used for treatment of B-cell lymphomas, Hodgkin or non-Hodgkin type. Which one of these miscellaneous anti-cancer drugs can cause fluid retention? Remember, imatinib is notorious to cause fluid retention. What is vemurafenib? Let me read that for you. It's a small molecule inhibitor of forms of BRAF kinase with V600E mutation. So you can see in the name RAF for BRAF kinase, and it's used for the treatment of melanomas. BRAF kinase is inhibited, and in order for the drug to be effective, the type of mutation should be V600E mutation in the melanoma for vemurafenib to be effective. Reducing angiogenesis in solid tumors is the mechanism of action of what anti-cancer drug? That is bevacizumab. It is a monoclonal antibody against VEGF. Remember, we mentioned anthracyclines can cause cardiotoxicity. What other anti-cancer drug can cause cardiotoxicity? That is trastuzumab, Herceptin. What's the basis of use of asparaginase as anti-cancer drug? Well, in rapidly growing tumor, asparagine becomes an essential amino acid, and asparaginase prevents this essential requirement of tumor cells. Well, thank you very much. This was a pretty rapid review, I hope, of anti-cancer drugs with some specific questions that made it a little bit less than rapid, but I hope it made it at least both rapid and high yield. Thank you. Have a wonderful day.